Dr. Richard Brown, Associate Professor of Clinical Psychiatry at Columbia University College of Physicians and Surgeons in New York City. My most recent book with wonderful colleagues is How to Use Herbs, Nutrients, and Yoga in Mental Health Care. And we have two new books coming out, one non-drug approaches to ADHD, and the other on the power of the breath to help patients with stress, or to help patients with stress-related problems or healthy people who want to feel even better. Integrative psychiatry medicine is combining the best of conventional medicine with other healing practices, which may come from old traditional healing practices or come from other countries and are not yet known about here. I would say that alternative approaches often are most valuable where a patient has a stress-related disorder. Understand that many doctors feel that 80% of medical illness is stress-related. And in fact, many general practitioners know close to half of the patients in their office are coming primarily because of stress causing or aggravating a medical vulnerability. So general practitioners in particular are well aware of the effects of stress. And using alternative practices can be very valuable. That's particularly things that like biofeedback or mind-body practices or exercise. Now, for some patients, particularly women or certain ethnic groups, they may be very vulnerable to side effects of prescription medicines. And often herbal things or more gentle treatments may be much more comfortable for them. There are certain conditions where standard medical treatment is just so effective and so simple. It doesn't make sense to have the patient, for example, get an herb or a nutrient that they will have to pay out of pocket for and keep paying for, or that may not work as well as a conventional treatment. We have many wonderful medicines and many wonderful conventional medical treatments. You know, we're not talking about replacing that. We're talking about everything has a strength and a weakness in life. Nothing is all good or all bad. And you just have to know, are you using the tool that works well for this patient and is comfortable for them? Okay, it fits their preferences. So for example, if a patient has obstructive sleep apnea, there's really no good complementary alternative treatment. You know, we have very good standard treatments. Or if they have restless leg syndrome for sleep problems and, you know, daytime alertness problems. So, you know, again, the doctor needs to weigh the pros and cons with the patient and help them come to an understanding of what their choices are. I could give you many examples, but one simple example is with a patient who's a doctor who had serious depression and anxiety that really made it hard for her to use her talents optimally. And it affected her in her training. It was very hard to get her paperwork done, for example. And she went on conventional psychotropic medications, antidepressants that help anxiety and depression and obsessional kind of thinking and behavior patterns. The problem is it meant she couldn't have an orgasm and she gained 50 pounds, which if you're one young woman who's dating, this is not the most desirable situation. And she came to me, and what we did was gradually change her over from her conventional medicine, tapering it down and using certain herbs and nutrients, as well as she learned breathing practices to help regulate her energy and mood. And within a year, she was off all of the medicine. She lost the 50 pounds. She felt better than she had and was more capable of doing, you know, her medical things on the alternative medicine. And she actually now uses a lot of alternative medicine. You know, from that she went on, she said, I have to learn how to do this to help other people. There are many different patterns that can come from introducing complementary practices. So with some patients, they may feel better using a combination of conventional medicine, but often at a lower dose, along with a complementary approach. Sometimes they feel better using the same amount of conventional medicine. Sometimes they end up reducing their medicine a lot, and sometimes going off conventional approaches. So, you know, what I'd say is that evolves over time. and the patient, and you discover that. I think complementary medicine is so valuable for primary care practitioners because so many of their patients have stress-related problems. And the patients often really appreciate what those things do for them. And many consumers complain to me, and also on surveys nationally, they're tired of doctors just pushing pills to them, and they want to have more interaction with their doctor. So especially in a primary care office, it's great. Also, like for example with depression, patients presenting to a primary care practitioner with depression often have a milder form that doesn't need the strongest medicine. So primary care practitioners see a broad variety of patients. You know, they're a gatekeeper in a sense. They're not people seeing the worst cases at all that often need really strong treatments or strong medicines. In terms of training, I'd say definitely someone should do significant reading, should go and take courses. They may want to take the training required to pass the Board of Holistic Medicine, for example, to have that extra boards. It's up to the individual, but I do see times where doctors kind of dabble in it because they have this idea, oh, this stuff is very easy or very simple, and I'll just tell them to take a little bit of this and a little bit of that. And it's just as complicated as conventional medicine. In some ways, it's more complicated. And also, it really requires, I would say, a little more emotional sensitivity. Okay, you really have to listen to the patient and to their responses, and this takes a little more time. And the doctor's empathy is a crucial tool. And unfortunately, we don't really train for that very much in most medical schools. So the doctor needs also to do some inner work, I think, to get the best results. So, you know, often younger doctors come to me and they say, well, how can I be like you? You know, I've heard you get these good, I've seen your patients that get these good results, and how can I be like that? And I'll say, you know, you can do some kind of spiritual practice or some artistic, creative work for 10 years, and that will make it much easier. But in our society, we go to a course, we learn a concept, instead of learning a different way of paying attention, a different way of responding to people. This is more challenging in our culture. In other cultures, it's very natural.